Critique of nursing theory. Theory uses description and critical reflection is important in helping users of these theories determine their usefulness or their modifiability for the user's purpose. Critique of nursing theory also helps to determine their usefulness for incorporating evidence-based practice. Terminate Evidence-Based Informed Practice by Chin and Kramer 2018. For this presentation, I'll be presenting a grand range theory, parse human becoming theory, and a middle range theory, health behavioral theory. The 5 elements of theory that I'm going to be looking at in doing this critique include the purpose, the concepts, the definition, the relationships and structures, the assumptions in helping to determine the objectivity facts about the theory. After the theory description is completed, critical reflection will be done to determine the adequacy of the theory to its purpose. The questions proposed for critical reflection include theory clarity, simplicity, generality, accessibility, and importance. As stated before, the 2 theories that I will be critiquing will be the grand range theory and the middle range theory, sparse human becoming, formerly known as man living health theory, and the mid range theory, health behavioral theory by Dorothy E. Johnson. Both theories will be critiqued using description of theory and critical reflection of theory guides from Chin and Kramer. I will also be doing a compare and contrast, which will be presented in the slide of these 2 theories. A client situation will be presented with anticipated outcomes using the grand range theory. In addition, the advanced practice process as segmented in the theory will be outlined. Parse human becoming theory. The purpose of this theory can be used to guide nursing practice, focus on patient welfare as lived and described. The concepts in the theory is meaning, rhythmicity, and transcendence. Definition: the humans are mysterious, lived personal values, not mechanical to be fixed. Parse human becoming theory, formerly known as the man-living theory, is used to guide nursing practice and focus on one's welfare as lived and described. Thereby looking at the world based on the human experience, the theory looks at humans as mysterious, showing emergent lived personal values and not as mechanical in nature, needing to be fixed. Sparse human becoming theory, which was originally developed in 1980 and later changed in 1990, is singularly constructed, referencing a person's living health. The theory was constructed from several other theories of that time. The human becoming theory looks at the compilation of psychology, biology, spiritual, and sociological factors and highlights a person as a singular being in a continuum of interactions with their environment. The assumption in the theory is about humans coexisting with the universe. Humans are able to choose freely and openly in situations and take ownership for the decisions they make. Humans are singularly being as continually evolving and changing based on their experience. Humans are multidimensional, changing and surpassing the possibilities. The concept in the theory surrounds meaning, rhythmicity, and transcendence. Assumptions are made about man becoming, which is inclusive of 3 subsystems, and also human becoming. The assumption about becoming are made in human becoming theory about man about man, about man, the assumption about becoming that were made in the human becoming theory about man is that the process of the human universe is rhythmically essential to becoming, and human coexists with the function based on changes in the universe. Humans are able to choose freely in any situation and bear responsibility for their choice. Humans as a singular being entity changes as the universe changes. So, as the universe changes, man changes. The intersubjectivity of becoming transcends the possibilities. Becoming is the uniform entity of humans emerging. Under meaning, humans choose freely in situations and their reality is constructed based on their lived experiences, and they coexist with the environment. In rhythmicity, humans coexist, and quality of life is based on a mutual process with the universe. Transcendence defines human as coexisting with the environment. Multidimensional quality of life is based on the co-transcendence with the universe. Based on the interrelation of the concepts, humans are determined to have the freedom to choose their paradox based on the quality of their life. They choose from the interaction and oneness with the universe. People are able to freely know what their quality of life will be and how they handle a situation. The human becoming theory looks at the compilation of psychology, biology, spiritual, and sociological factors and highlights a person as a singular being in a continuum of interactions with the environment. In human becoming theory, the person or patient slash human is inseparable from the environment, and the environment is complementary to the human evolution. The health process is open and becoming synthesizes values. Nursing is considered human science and uses their distinct knowledge to help the human patient. In this theory, the nurse and the patient work together to change health patterns. The goal is not to fix the problem, but empowers the nurse with the ability to see the patient's perspective, which allows for a better nurse patient relationship, with the nurse guiding the patient to a better patient outcome or health goal. This theory has structural clarity and structural consistency, with a connection seen between the concepts of the theory and the theory as a whole. The theory was simple, with only three concepts. The theory was less general but broad in scope. The theory was also very accessible and is important to the nursing knowledge. Dorothy Dorothy E. Johnson Mid-Range Health Behavioral Theory, developed by Dorothy E. Johnson in 1968, looks at nursing care as being guided by research-based knowledge. Her theory was developed in an effort to foster effective, efficient behavioral functionality in the patient and in the prevention of illness. Health was defined as purposeful, adapting to external and internal stimuli in order to achieve and maintain stability and comfort. The two major systems of humans are behavioral and biological, with medicine's role being focused on the biological and the nurse's focus on the behavioral. The environment that a patient lives in and incidents that occur in that environment directly influence the patient's behavior. The physical, emotional, mental, and social realms response to internal and external stimuli is purposeful and adaptive response by humans in an effort to maintain stability and control to achieve health. Achieving equilibrium is the primary goal in the theory. The patient is considered a behavioral system comprising seven behavioral subsystems, which include dependency, affiliation, ingestive, elimination, sexual, and aggressive, and achievement. Each of the subsystems have functional requirements, including providing a nurturing environment, protection from harmful or unpleasant environments, and providing stimulation to achieve growth. The affiliative or attachment subsystem consists of intimacy, strong social bond, formation and social inclusion. Dependency subsystem consisting of being recognized, attention and physical assistance. Indigestive subsystems look at the social event structures that is surrounded when the food is eaten. Elimination subsystem, which is defined by different social cultures, influence excretion of waste in acceptable behaviors. And due to the different cultures, the pattern remains different. Sexual subsystems are affected by both social and biological factors which affect behavior. Aggressive subsystems related to self preservation, generation of defense, response to life, threatening or territory situations. Achievement subsystems evokes behaviors which try and control the environment. Dorothy E. Johnson determined that when a condition is deemed a threat to social or physical health, nursing, which is the external regulatory force, responds to preserve the integration and organization of optimization in the patient's behavior. Nursing concern is with a patient's non segregated whole. Nurses were made responsible for four goals in helping to assist the patient to attain equilibrium: behavioral proportionality with demands, patient able to modify behavior in support of biological interactives, patient being able to wholly benefit during a time of illness from the physician educated instructions, absence of behavior related trauma, which is constitutional with illness. The mid range health behavioral theory was both structural clarity and consistency. The theory had some complexity due to the number of sub-concepts in the theory, the interrelations between the concepts. The theory was noted to be very general and accessible. The theory is also noted to be very important to nursing practice, especially in the evaluation phase. In compare and contrasting these two theories, the human becoming theory and the theory of health behavioral. The human becoming theory has a social, biological, spiritual approach, whereas the health behavior theory focused on two major subsystems, biological and behavioral. Human becoming theory has three concepts, meaning rhythmicity and transcendence. The grand range human becoming theory focused on the human being, one with the environment, and the human quality of life being determined by what's happening in the environment. The human also had freedom of choice in a situation and was responsible for the choice they made. Man's reality was determined by their lived experience and their environment, which they are inseparable from. The theory is not based on fixing a problem, but on getting the nurse to see the patient's perspective based on their lived experiences, while guiding the patient toward their health goals. Health behavioral theory is just like the human becoming theory. Believe the patient behavior is influenced by the environment and occurrences in the environment. And another similarity in the theories is that one's health is purposeful adaptation from internal and external stimuli, the environment. The health behavioral theory adaptation took place physically, mentally, emotionally, and on social realms, just as in human becoming theory, where the person is one with the environment and the environment interaction determines their quality of life. The health behavioral theory had four concepts: interdependence, interaction, integration, with seven subconcepts: attachment or affiliation, dependence, ingestion, elimination, sexual aggression, achievement. Nursing role in human theory is to assist the patient by focusing on their behavioral system and finding equilibrium. In applying these theory, the client situation, and expected outcome using the framework of human becoming theory. Lisa is a 46-year-old patient admitted to inpatient drug rehabilitation. Lisa suffers from an opiate addiction and type 2 diabetes. With uncontrolled blood sugars, her blood sugar numbers are over 200 while fasting. Lisa has no support system and has never had suitable housing, food, or clothing, with a presentation of hoarding and a history of being used for sex trafficking, with post traumatic stress disorder surrounding being the victim of sex trafficking. Using human becoming theory, Lisa, never having a support system and being one with the environment would call for the providers listening to Lisa and approaching her from a bio, psychological, psychosocial, spiritual approach. Lisa prefers female staff due to her lengthy history of sexual abuse. So a female nurse and counselor will be assigned to Lisa to guide her to her health goals. The nurse would need to listen to Lisa as she is one with her lived experience and guide her through her blood sugars, which is contributed by her poor diet and her hoarding and eating food at night. Outcome: Lisa will learn coping skills to help her deal with her trauma. Lisa will be educated on her diabetes and how to monitor her blood sugars. The process of advanced practice as articulated with the human becoming theory. The human becoming theory is applicable to many areas of advanced practice. The advanced practice nurse, in caring for and providing treatment to the patient, needs to utilize the model's concept and remember that the patient is one with the environment. When prescribing medication, if the patient has no way of getting the medication due to environment, the nurse practitioner will need to provide enough samples or order the medication by mail order delivery. As advanced practice nurses, we have to learn about our patients during their history, and based on the theory of human becoming, treat our patients based on their preference. As the human is freely choosing and able to bear the responsibility of their decision. So if the patient has a more holistic belief, we need to work with them. The human becoming theory is not about fixing a problem, but gives us the ability to see our patient's perspective. The human becoming theory is about working with the patient as they are one with the environment and has providers being able to see things from the patient's perspective. The health behavioral theory can be used by assessing the patients for their lived experience and noting behavioral issues that may arise due to those lived experiences. The advanced practice nurse is working with the patient to achieve their health goal by formulating a treatment plan that's conducive to the patient's lifestyle and in maintaining equilibrium by working with the patient and not trying to fix a problem. Both Sparks' human becoming theory and Dorothy E. Johnson health behavioral theory